My name is John Franklin Sierra. I'm with the LA County Chief Executive Office and their Alternatives to Incarceration Initiative Office. But very recently, I was with the Department of Mental Health. And in both places, I've been helping to lead the county's efforts around what we've called alternative crisis response. Next slide. I'm going to very briefly just touch on what we've been doing in alternative crisis response here in LA County, some of the key projects and the vision and, algorithmically how we've tried to design our system to produce the kind of flow to crisis services we want, and then try to quickly get to the last slide on, the key takeaways for this discussion on the role of social media in all of this. Next slide. Just a bit of background. We've been working on this effort we've called Alternative Crisis Response since the summer of 2020. It's an initiative of the Board of Supervisors and has been a partnership between the County Department of Mental Health and the Chief Executive Office. Really trying to lean into the SAMHSA guidelines and the vision for the system of, having someone to call, someone to respond, and somewhere to go all the time, at any time someone's experiencing a crisis, and as a preferred and alternative to law enforcement response to folks in crisis. We've engaged a consultant, RA International, through this process that has provided tremendous support to our efforts. And that consultant was their engagement was partially funded with a generous grant from the Balmer Group. Next slide. So, we've engaged a lot of stakeholders throughout this process, especially partners in law enforcement, fire department partners, other health and human services partners throughout the county to really try to understand, how we can best triage these calls to civilian responses whenever possible. We've really tried to lean into 988 as our kind of preferred no wrong door place for individuals to access crisis care in the county. At the same time, we do understand that some crises will still require a 911 level response, either from law enforcement or EMS. But I think our goal has been to determine, can we make 988 and civilian crisis response services the default and opt in to, a higher level response from 911 when there is a clear public safety threat or a clear medical emergency, and otherwise rely on 988 and civilian services. This is a diagram we put together a while ago to try to articulate that there are these level 4 or level M crises, which probably need to remain in the 911 system, but we want to have clear reasons for engaging those 911 resources in those events. And then otherwise, for those level 3 or below crisis events, rely on the 988 system. Go to the next slide, shows kind of how we're trying to operationalize that 4-level algorithm, really trying to arrange the system and design the system such that we're leaning into 988 as a preferred entry point for requesting crisis care from individuals and pushing crisis cases toward the right side of this diagram whenever possible. And obviously this has advantages by pushing calls through 988 as much as possible. 988 will be designed to de-escalate those calls over the phone with no need for further response as much as possible. And if there is a need to go back to 911, they can do that, and they have, the standards for when and how to do so. But otherwise, the hope with this kind of system setup is that we can reliably push calls to 988 and to civilian mobile crisis responses as needed as much as possible, and only rely on, again, 911, law enforcement, and EMS when there's a clear public safety threat or medical emergency reason. Next slide. We're pursuing a few key projects to realize that vision that we've laid out. We're working on expanding our 988 call center in the county, expanding mobile crisis outreach team resources in the county, hiring peer staff for an existing program that the county operates for mobile crisis response, where the peers had not been worked into that program before. So there are a number of efforts that we're pursuing in the county really to realize this vision in partnership with a whole host of stakeholders. This is just a snapshot, but our alternative crisis response website for the county, which I actually linked in a previous slide, has more details on all the various projects. Next slide.
Excuse me, I just want to note that someone has an open mic. Please close that. We hear a child in the background.
That is actually my child. So don't worry about that. That's my my almost 2-year-old. She's super cute. She just got back from the park. A few key performance indicators we're working on, making sure the system is tracking. We want to make sure that we've set the system up to resolve crises without escalation to a higher level of care as much as possible. We'll be tracking the amount of 911 calls we're able to divert to 988 and looking to kind of maintain that at a certain standard. It'll take time to get there, but we see that as a key part of all of our efforts. And of course, we really need to be tracking and making sure that for those individuals who do need an in-person mobile crisis response from a civilian team, that we're getting that response quickly, much more quickly than is currently happening in the county, so that they can provide a reliable alternative to law enforcement response for those individuals who need an in-person response, but don't need it at the level of law enforcement. And throughout all of this, we are really working to ensure we can disaggregate these metrics we collect by race and ethnicity, gender identity, age, geography. Providing equitable access to these services is of primary importance in the county, and we know we need to keep tracking data and accordingly ensure we're actually meeting those equity goals. Next slide. So some of the key takeaways here in thinking about the role of social media here. There's been, evidence that upwards of 19% even of 911 calls could be served by a civilian response instead of law enforcement or EMS. A recent report from the Vera Institute of Justice examined a lot of data to that respect. There's been other reports noting that many crisis calls, the bulk of crisis calls, can typically be resolved without need for an in-person response at all. And the 988 crisis hotlines, are really, they're trained to de-escalate crisis calls and will only engage 911 when there's a clear public safety threat or medical emergency. So in that light, if we're going to be talking about social media algorithms linking to a crisis services, I think we need to consider whether they should link to 988 by default during a suspected crisis first, and really only link to 911 as a last resort if 988 can't be reached. Also, just thinking about how a social media algorithm would look for and triage crisis calls to a crisis call center like 988. Looking for trigger words, is something that I think has limits and potential biases. They may help in indicating a need to link to 988, but I do think ultimately a human being trained in culturally competent triage and de-escalation needs to intervene as soon as possible. We know that there are many different ways in which people's crises manifest, and if they're not triaged competently, they could lead to an unnecessary 911 escalation. Lastly, just thinking about, when social media reaches out to 988 or a crisis hotline on someone's behalf, is that comparable to when a friend or a family member or other collateral reaches out on someone's behalf? Are there analogous best practices and effective techniques for managing a call from a collateral that's calling on someone's behalf in crisis that would be applicable to the social media companies? I think this is an area that could benefit from further research. That's my presentation. Thank you, everyone.